Cardio-pulmonary resuscitation (CPR). Share on Pinterest. CPR is one type of first aid that can save lives. If the person is not breathing, the first aider will need to perform CPR. In 2008, the European Resuscitation Council and the American Heart Association (AHA) reversed their policy on the effectiveness of only using chest compressions and advised that they can be used without artificial respiration on adults who suddenly collapse in cardiac arrest. It is unlikely that CPR will start a heart. Its purpose is to maintain the flow of oxygenated blood to the brain and heart, preventing or at least delaying tissue death. CPR can extend the brief window of time during which successful resuscitation can take place without permanent brain damage. In 2005, the International Liaison Committee on Resuscitation (ILCOR) agreed on new guidelines. The new guidelines make it simpler for first aiders and healthcare professionals to carry out early resuscitation. The new guidelines stated that rescuers should progress straight to CPR if there is no breathing, rather than checking for a pulse. They also added that rescue breathing must not be performed without chest compression. There are two main steps in CPR: applying chest compressions and then providing breaths. Apply 30 chest compressions. The first aider should kneel next to the person who is injured. They should be lying on their back. For adults, place the heel of one hand in the middle of the chest. Place your other hand on top of the first hand and interlace the fingers. Push the chest down about 1.5 to 2 inches. If the person is a child aged between 1 and 8 years, compress to a maximum of 1.5 inches with one hand. Let go, and wait for the chest to come back up completely before repeating. Your elbows must remain straight throughout. Push the breastbone up and down to a depth of about 5 centimeters about 30 times, at a pulse rate of 100 beats per minute. Provide 2 breaths. Make sure the airway is open, and pinch the nose so it closes. Gently raise the chin upwards with 2 fingers of your other hand. Take a deep breath, seal your mouth over that of the person with the injury, and exhale into the airway. You should see the chest rise and fall. To get another breath, lift your head and breathe in deeply. Perform steps 1, 2, 3, and 4 again. Repeat the 30 chest compressions followed by the 2 breaths about 5 times, and then check for normal breathing. If they are not breathing normally, carry on performing CPR. If breathing restarts as normal, stay with the injured person until help arrives. Chest compressions alone can be lifesavers. The crucial factor is time. Make sure you respond quickly. It is important not to let your hands bounce when performing chest compressions. Make sure the heel of your hand is touching the chest throughout chest compressions. You might hear some pops and snaps during chest compressions. These are normal, so do not stop. If you like the video, kindly subscribe by Baby Time FYI. Thank you.